If you are a parent of a child with type 1 diabetes and you want to know how to manage their sick days, do watch this video. Whenever a child has fever or vomiting or loose motions, you as a parent need to know that you need to check their sugars more frequently. If you're checking sugar levels 3 times a day or 4 times a day on a daily basis, you need to check at least 6 to 7 times per day on days when they are sick. So what I would advise you is check before breakfast, 2 hours after breakfast, check before lunch, 2 hours after lunch, check before dinner and bedtime for sure, and sometimes in the midnight at 2 to 3 am as well if required. The benefit of checking sugar levels multiple times a day is you will know if the sugar levels are going low due to the vomitings and motions, or sometimes the fever can shoot up the sugars to high levels as well. What if the sugar levels are going high? Then you should know that you need to check the urine ketones in such a situation. Urine ketones, as there in the previous video, you should check by dipping the urine ketone strip into the urine and looking for the color change. If the ketones are positive, your goal should be to bring down the ketones to negative. So how do you do that? If the sugar levels are high, you should give an extra dose of rapid acting insulin in order to bring down the sugar levels to normal. It can be given with the food, or even the 2 hours after food also you can give a repeat dose. And how much dose should you repeat is based on the kilo body weight. If you have a child of 10 kilos, if the ketones are just mildly positive, then you can give up to 0.1 unit per kg as an extra dose 2 hours after food. Whereas if the ketones are large, in such a case you can give 0.2 unit per kg also as an extra dose of rapid acting insulin. And make sure to check the urine ketones daily 2 to 3 times to see if that comes back to normal. The third thing is hydration is very important during sick days. So you should give fluids which can raise the blood sugar levels if suppose the sugar levels on the lower side, such as giving lassi or juice or ORS or coconut water as well. If the sugar levels are high, you want to give fluids containing less glucose in it, such as soups or buttermilk or water. So these are the options which are there to cut the sugars and to control the ketone levels well during sick days.